Okay guys, this is Module 17, Nursing Care of Patients with Behavioral Disorders. Here are your learning outcomes. I'll give you just a second to read each one of those, and we'll move on. Okay, first we're going to start talking about behaviors. You have addiction, nicotine use, substance abuse and or physiological dependence, alcohol abuse, and assaultive behaviors. Now we have our substance use disorders. We're talking about addiction, tolerance, physical withdrawal syndrome. We'll look at those definitions. Addiction is just the repeated compulsive use of a substance that continues despite negative consequences. Those consequences could be physical, social, or legal. Your tolerance, a condition in which increased amounts of substances are needed over time to achieve the same effect as that previously obtained with smaller amounts. And then physical withdrawal syndrome is a physiological response to the abrupt stopping or reduction of a substance use, usually for a long period of time. Withdrawal symptoms are specific to the substance use, so it depends on what substance the patient is taking as to what reaction or withdrawal symptom they could have. What do you think the single most difficult addiction to overcome would be? Many experts believe that it's nicotine. Nicotine would be the most difficult addiction to overcome in society today. When talking about substance use disorders, we see that the patient needs more to achieve the same effect. They spend more time trying to obtain the substance that they need. They give up social functions to be able to use. They've tried, but they're unable to quit. They have difficulty with their job or families. Sometimes they can't even maintain a job. They use regardless of problems. It doesn't matter what's going on, they still feel the need to use. And they use to avoid withdrawal symptoms, because sometimes withdrawal symptoms can be similar to what impending death could feel like. And strong cravings for the substance. If you look on page 1373, I think that's chapter 57, you'll see the substance-related and addictive disorders and conditions in which the patient feels, and that's on the bottom of the page. Just a continuation of the last slide, substance use disorders. They're unable to fill role obligations, maybe as a parent, reoccurrent legal and personal problems. These patients are typically in and out of jail or unable to pay their bills, continue despite their problems, whether they can afford it or not. They continue to substance abuse and participate in hazardous situations. These patients will do most of the time whatever they can to be able to get the substance they need to continue their habit. According to the National Institute of Drug Abuse, every day more than 115 people in the United States die after overdosing on opioids. The misuse of and addiction to opioids includes prescription pain relievers, heroin, and synthetic opioids such as fentanyl, and is a serious national crisis that affects public health as well as social and economical welfare. The Center for Disease Control and Prevention estimates that the total economic burden of prescription opioid misuse alone in the United States is $78.5 billion a year, including the cost of health care, lost productivity, addiction treatment, and criminal justice involvement. We look at the effects that dependence has on others. You have dysfunctional relationships, codependence, and enabling. In your dysfunctional relationship, these are usually seen in alcoholic families or in work environment. they're dishonest, they're not willing to talk about the situation, they get angry if people try to tell them they have a problem. Family and friends start covering up their behavior and their lack of responsibility. And then you have your codependents, and this can be just as serious as actually abusing the substance themselves. They lose their identity and purpose, and they begin to exist solely for the abuser. And then you're enabling. That's when actions take away the opportunity for the user to take responsibility for their own actions. These are usually by friends or family who think that they can help the patient, or that the patient can get help on their own, and they enable them and try to cover things up for them when in reality they're just making things worse. Here we're talking about nurses who become chemically impaired or diverting drugs. I have clicked on all three of these links on my computer. If you right-click them and go to Open Hyperlink, you should be able to watch these videos. It is very, very common for nurses to start diverting drugs, not intentionally. Sometimes it's because they injure themselves, or they hurt their back, or something happens that causes them to start taking a little bit and then feel like they need more. So it is something that's very big in the United States, and it's hard to believe that it happens, but it truly does. So take a little bit of time and go through and watch these videos. I think one's 10 minutes, one's around 5 minutes, and one's around 7 minutes. We have our etiological theories, addictive personalities, failed to pass through the oral stage of development, genetic metabolic disorder, perception of drugs as a miracle cure, or the cognitive behavioral theory. Some therapists believe in addictive personalities as this being the cause of people being dependent, that they're just born with that type of personality. Your psychoanalytic therapists, they believe it is caused by a failed pass through the oral stage of development, and this goes back to Freud. Your biological theorists, they believe in the genetic and metabolic links. There are numerous studies that imply that there are genetic metabolic disorders that are linked to substance abuse. And then you have your cognitive theorists, they believe that the cause lies in the way a person perceives being high. We must realize that a client with chemical dependency may be admitted with medical problems associated with the substance abuse, dehydration, liver failure, or unrelated problems like diabetes or cancer. Now we have our alcohol use disorders. You have additional symptoms. They're binges, blackouts, vomiting, dehydration, disorientation, vulnerability to infection and accidents. Life expectancy of alcoholics decrease by 10 to 12 years, and they feel like they can quit anytime they want. Anybody can become an alcoholic. It's not just certain people. Any economical status, both genders, male or female. And think about social drinking versus abuse drinking or compulsive drinking. How do you know when someone actually does have a problem when they're taking it too far? Binges typically last 2 or more days. You have withdrawal symptoms. You have your DTs. These usually last about 4 to 12 hours. They have hallucinations, tremors, seizures, elevated blood pressure and pulse, cardiac dysrhythmias. When alcohol intake is significantly reduced and neurotransmitters previously suppressed are no longer suppressed, they rebound, and you have brain hyperexcitability, and this causes their symptoms. This is a medical emergency. Peak is 24 to 48 hours. These patients can become very violent. They, especially during hallucinations, they don't know what they're doing. They can't remember what they're doing. They have to be medicated to be able to keep them stable, to keep them from injuring themselves or someone else. We have a video here on how to recognize DTs in this video, and it does work. I did check it, so you can right click it and click open hyperlink, and it's about 2 minutes. We look at our therapeutic interventions. We have our support groups such as our AA or our Alcoholics Anonymous. This is a 12-step program that offers support through others that have stopped drinking. You have your cognitive behavioral therapy, and that advocates belief that with homework and practice, a person can learn to think differently about the event that led them to drink. So it's like a retraining of the mind. You have your psychotherapy. This is one-on-one therapy that also involves bringing in the whole family, because addiction does affect more than just the patient. And then your medications, you have medications that help with aversions and anti-craving medications that have been approved to treat alcohol and alcohol use disorders. You have drugs such as Antabuse. It is an aversion medication that is sometimes prescribed as a deterrent to using alcohol. It should never be given without the patient's consent. This is a type of medication that if the patient ingests any type of alcohol, it can make them deathly ill. And things that contain alcohol could even include mouthwash, aftershave, cough syrup. Anything that has any alcohol in it can cause these patients to be deathly ill. And that's the purpose of the medication, is to keep them from wanting to drink any more alcohol. The effects of Antabuse can last 2 to 3 weeks after the last dose. You have Campril, and it's used to combat cravings, and is specifically indicated for maintenance of abstinence from alcohol in patients who have already stopped drinking. Your hospitalization, sometimes patients need to be hospitalized so that they can have a closer care, or they can have one-on-one care to keep them from keep them from relapsing. Relapsing is not uncommon for people, especially if they're home, if they're alone, if they're going through some kind of self-crisis. They can go back into the situation they were in before they got help. A common screening tool to determine if a patient has a drinking problem is called the CAGE questionnaire, and you can find it on page 1375. And it will go over it. Cut down. Have you ever felt like you should cut down on your drinking? Annoyed. Have people annoyed you by criticizing your drinking? Guilty. Have you ever felt bad or guilty about your drinking? Eye-opener. Have you ever had a drink first thing in the morning as an eye-opener to steady your nerves or get rid of a hangover? A yes to 2 or more of these questions suggests that there could be a drinking problem. For the type of drugs that are typically abused, you have your caffeine, your nicotine, your marijuana, cocaine, crack, PCP, your methamphetamines, and your prescription medications. And don't forget about your inhalants, your paint thinners, your lighter fluid, gasoline, glue, anything that can be used for huffing, paint cans. Overdoses are the leading cause of unintentional death in America. Over 16,000 overdoses are from opioid painkillers. Additional signs and symptoms are similar to alcohol use disorders. You will see your red, watery eyes, runny nose, hostile behavior, paranoia. These patients can have needle tracks on their arms or legs. If you look at page 1376, table 57.7, you'll see substance abuse summary. Make sure you look over that. Your pinpoint pupils are associated with your opioids. Your dilated pupils are associated with your cocaine. Your therapeutic interventions contain your Narcotics Anonymous, your group therapies, your psychotherapies, your methadone programs, and the 1-800-QUIT-NOW number. Most of your ERs, your EMS trucks, and now my understanding is that you can just get Narcan through the pharmacy if it's prescribed to you by your physician. Narcan is one of the drugs that we use to reverse the effects of opioids if a patient is overdosing or has overdosed on a type of opioid medication. You want to have some community awareness and education. These patients need to be educated and they need to be supported. You have your nursing care for ineffective coping, expect sobriety, identify behavior while under influence, teach physical impact on body, be honest, provide a support group if possible, confront behaviors, use positive reinforcement, provide a safe environment, observe for use during hospitalization, and practice tough love. We'll talk about nicotine. These patients need to make a plan to quit, manage cravings, find social support groups, and sign up for free text. Quit Guide is a free app that helps you understand your smoking patterns and build the skills needed to become and stay smoke-free. New to Quit Guide in 2016 is the ability to track cravings by time of day and location and get inspirational messages for each craving you track, which keeps you focused and motivated on your smoke-free journey. With your assaultive behaviors, violence is usually the abuse of power, and it can be spouse on spouse, parent on child, child on parent. They typically have a past history of violence or a past history of some type of criminal activity. This information isn't in your book, but you can find it in your NUR 101 or your 111 book if you have one still. What you need to know is on this slide. Assaultive behaviors with female victims, they usually are at greater risk when they're trying to leave an abusive relationship. Pregnancies increase the risk for abuse. Children under 3 are typically at risk for abuse, or children that are different or have some kind of mental disability, and elders who are disruptive, dependent, or unhealthy. These are all at risk of being assaulted. Abuse can occur in any families. It doesn't matter the economical, educational background. It could be from a cycle of violence throughout the family, or it just could be from cultural differences. Violence can be physical, sexual, emotional. It can be from neglect or economic maltreatment. Most of your assaults are done by family or friends or somebody that the person being abused knows. Very rarely is it done by a stranger. Characteristics you'll see in a victim could be low self-esteem, the feeling of being helpless, hopeless, powerless, guilt and shame. They protect their perpetrators. They accept responsibility for what's going on. They feel like it's their fault, and they're typically in denial. The perpetrator uses threats. They use intimidation or physical punishment. They're usually the disciplinarian, and they may have a history of substance abuse. This isn't always the case, but it is a possibility that they have had a history of substance abuse. Babies usually suffer from shaken baby syndrome from abusive parents or an abusive person. That's intracranial hemorrhage. They have respiratory distress, bulging fontanelles, increased head circumference, and retinal hemorrhage. You can see bruising on these babies before 6 months of age. They may have burns, fractures, human bite marks, head injuries, and these could be on children or adolescents. And then on your elderly, you want to look for bruising, lacerations, abrasions, or fractures. There are mandatory reporters of abuse, especially amongst your children and your elderly. There are penalties that could come along with not reporting a known abuse. You want to make sure your documentation is complete and accurate, especially if the case makes it to court. You have your SANE nurses. These are your sexual assault nurse examiners. They usually aid the physicians in the emergency room when a patient comes in with a suspected sexual assault to gather evidence for the police. It's a very meticulous process. They have to make sure that they have everything they need in place so that the evidence isn't tampered with. And then you want to refer these patients to a support group or case management, anybody that can help them get through their situation. We're into our review questions. What symptom of major depression should receive the highest priority? That's your suicidal ideation. Positive symptoms of schizophrenia include which of the following? Which of the following are symptoms of the delirium tremens or DTs? Select all that apply. That's your number 1, 2, and 3. Hypertension, tachycardia, and diaphoresis. Flashbacks are a key symptom of which disorder? That's number 1, your post-traumatic stress disorder.